for hemophagocytic lymphohistiocytosis. That name is quite a doozy. The GI doctor who was on this week thinks that I need to use my gastrointestinal tract to kind of improve the integrity and decrease the likelihood of gut bacteria permeating that bowel wall, which is what I've been trying to do for the last year anyways, but I guess that's beside the point. So while I am still in the hospital and on antibiotics, I was supposed to eat a bite of something or either run feeds, and I opted to do some of this Naughtamoo vanilla ice cream that I have tried in the past, and I know I don't go into a full tizzy from it mouse-wise, so.
It doesn't do you any favors either.
I mean, yeah, it's on anaphylaxis, and a lot of it kind of vents out anyways because I am on a continuous drain. Yeah. Doesn't taste very good.
Is it different? I don't see the little vanilla beans in it this time.
Oh yeah, they're there.
I'm blind. I'm illiterate. What else have I been called?
She's just not been,
I'm not on the top of my game. Let's just put it that
We
way.
got to bring Teddy Graham up to the room. He'd been in a depression at home because he hasn't been able to see my mom or I.
He loves his girls.
And now he's as content as can be. And he's being so good. He hasn't barked or jumped on people, or he even got on the elevator fine. He did really good when we went to a DC, or not DC, but Nashville.
Yeah, he did really good in Nashville when we went to the conference.
Other than the elevator incident, but he learned quickly.
And this is the vinegar.
Okay. He was afraid of elevators.
You're so pretty. Yes, you are. Oh my goodness. How old is he?
He was a year in March.
I flushed my J tube with 7 mLs, and I ate that ice cream, and that night spiked fever, and it lasted until noon this morning. We just don't know this whole situation here. Everyone is at a complete loss. They are running a panel of different antibodies to check for Crohn's disease because some of my intestinal tests came back showing inflammation, and the inflammation could be from inflammatory bowel disease. I've been scoped for Crohn's and ulcerative colitis. I can't even have ulcerative colitis because I don't have a colon, but I've been scoped for inflammatory bowel disease in the past, and it was negative. Sorry, my nurse came in and her laundry is really strong. But I've been checked for inflammatory bowel diseases in the past. It's been negative, but those are something that you can develop over time, and I do have family history. So they are being proactive there. I doubt anything will come of that. And they checked my hemoglobin again, and I'm gonna get an iron infusion. Oh.
And there's all the golf balls.
Oh my gosh, these are so cute.
Oh yeah, they're all golf balls.
So I'm gonna see if Alan will help me put this in the fridge. It's her fiance's birthday, and so she was giving him a surprise birthday party. Okay, we'll see. You have to have the first bite though.
I'm utilizing all hospital patient quality for you, sir.
I don't see where it looks chocolate.
Yep, Marbles, where's that? It's like not too rich.
It's very rich.
I mean, the marble part of it, rich.
Publix. It's very thick.
You do good.
It's a vegan cake. It's from a vegan bakery. And then we didn't know if we were going to have her do golf or fishing as a theme. And if these were good, I was going to have her do the wedding. But
It
of
might
course,
taste totally
I
different.
can't judge it myself, so it's hard to.
Do you want to feel it?
So they have been looking for the last almost 3 weeks now on the cause of these persistent fevers.
It was stupid, and I lost some money. I tried to get some quick cash flow with it.
I have had an entire workup. They have tested for literally everything. ID was testing for syphilis, HIV, herpes, mono, just everything under the sun. I had stool testing to check for viruses and different bacteria there. All of that was clear in the clear. Some of my blood counts have been wonky, and there was a particular level called LDH that was 1,600 plus, which is way out of range. And it's usually indicative of something very badly going wrong in the body. My ferritin levels, which are normally non-existent, and we struggle to get them to at least like a 3, are almost 1,000. It was 999. So all of these labs prompted them to do a bone marrow biopsy, and I saw that's cough. Prompted them to do a bone marrow biopsy, and the bone marrow biopsy was originally, they were thinking lymphoma, but the bone marrow biopsy but the biopsy came back clear for all my cancers. Instead, it's showing something called HLH, or Hemophagocytic Lymphohistiocytosis. That name is quite a doozy, but what it means is that cough is one of the symptoms, along with fevers. But my immune cells, like my T cells and lymphocytes, those are what fight off invaders and bacteria, viruses. They basically clean up the immune system. Well, mine are angry, and they have decided to eat my healthy cells. And because they are eating all of my healthy cells, it is making me very ill. I have most of the criteria. They are waiting on a couple other tests prior to beginning treatment. But since my fevers have improved some and I'm not at 104 in the ICU, I am allowed to go home and wait on the results, and then we'll figure out what to do. HLH is pretty rare. It can be primary or secondary. When it's primary, it's caused by a genetic mutation. But when it's secondary, it can be secondary to cancers, the Epstein-Barr virus, sepsis, autoimmune diseases. Just something going awry in the immune system tends to cause it. And it comes in flares, where the fevers will last a few weeks, and then they will start improving until it happens again. But along with the fevers, you experience a drop in blood counts, which is what I've been experiencing, and other unpleasant symptoms. Prior to finding the HLH, they did a MRI with contrast, and that was scary because I have not had contrast since I have been a severely afflicted mast cell activation syndrome patient. So nobody was certain on how I was going to respond. thank the Lord I did not have anaphylaxis to the contrast. I actually tolerate the contrast better than the IV Tylenol that I was taking to try to get my fevers down. But the results of the MRI showed that I had intussusception again. And because I had intussusception again, they saw that it was in my jejunum, right where the tip of my GJ tube ended, because the J portion of the GJ tube is threaded throughout the GI tract. And the tube can be a lead point for intussusception because it gives the valve something to grab onto. And apparently, because of my GJ tube, the intussusception was occurring over and over and over again because the valve would not release because the tube was present. So they have since removed my GJ tube and replaced it with just a long peg here. I can't stand the peg right now because it just keeps leaking even worse than my GJ. We can replace it with a non-balloon tube at a later date. I don't know what I'm going to do about the J portion, especially since I am supposed to be trialing meds for bowel rehab. I need a regular J tube, but undergoing surgery again is not wise. There's just been a lot going on, and intussusception in itself can cause fevers. I've had it once before, and I had a very high fever. I was in the ICU. I couldn't lift my head up off the pillow. My pulse was over 150. My temperature was over 103. I was very, very ill, but it was presenting differently than how I'm presenting now. My fevers now are very cyclic. They come on at a certain time and they break at a certain time, which follows more of the HLH pattern. So we were trying to originally blame it all on the intussusception, and they did not know if I was going to have bowel surgery, because if the intussusception does not resolve on its own, it does require surgical intervention. As I've explained in a previous video, when I had intussusception in the past, intussusception is when part of the bowel telescopes in on another part. So if you think of a telescope, how it collapses in, that's what's happening to the bowel. And as that occurs, it causes an obstruction, whether partial or full, depending on how severely it's occurring, and it can damage the bowel. In my opinion, I think that the bowel damage was a trigger for my severe fevers too. And that's why every time I would go to introduce feeds or have a sip of water or what have you, a couple hours later my fevers spike, because that has improved quite a bit since they have pulled my GJ and replaced it with the peg. So it's finally able to heal. Over the last couple of months, I had noticed that when you have a GJ or when you have any feeding tube, your body tries to digest it. It's just your natural motility. And when my GJ would suck in, all of a sudden in the last few months, I would get this pain in my right upper quadrant area in my intestine. Every single time the tube would move internally, I could feel it. Whereas I've had a tube since 2013, and that had never previously been the case. So we are all pretty certain that the intussusception is something that's been happening for quite a few months. And although it's not the entire picture of what is going on, it was definitely a contributing factor. But this HLH deal is definitely the main culprit. It's kind of scary to end up with some rare disease just out of nowhere that nobody knows about, and it's very difficult to diagnose. I mean, I'm thankful that they found the evidence that they did, because I guess they could have easily missed the signs, and I'm thankful that things have improved on their own without huge intervention right now. There are treatments for this, but they are immune drugs. I at this time, we just don't even know if this is something that does need to be treated, definitely. But like I said, they wanted to wait on 3 other tests before we made our overall decision. I've been here for 3 weeks on Saturday, and I am just ready to go home, even if it's for 2 days. And if I end up right back, but I need to go home for my sanity. I want my own TPN. The one at the hospital gives me headaches, and because the amino acid brand is different, the hospital uses Baxter Clinisol amino acids, whereas I'm used to Plenamine, which is by B. Braun. And I don't like nurses messing with my line. It makes me have anxiety. So I'm just ready to go home. All the nurses have been wonderful, and even the nurse I had last night was wonderful. But she decided she was going to take the cap off the TPN before connecting it to the machine even, and hooking it up to me. And so the whole time she's trying to connect it to the machine, she's got the cap off and she's touching the side of the machine with the end that's about to go on my line. And I'm just like, no way, Jose. That's not going on me. I personally would have felt more comfortable just abandoning the entire bag of TPN, which meant I wouldn't have gotten another bag until late tonight, and I don't know how my sugars would have held up. I don't typically do well fasting for long periods anymore, but she respiked the bag instead, which doesn't make me feel comfortable either. But at the same time, if you complain a lot, then that's how problems get started, and then all it takes is one nurse that doesn't like you, and then it's like the rest of them don't like you either. So I just do not want to cause any problems. But yeah, I don't want to get sicker either and have sepsis on top of whatever the heck this HLH business is. The hospital is just a stressful environment, and it's been 3 weeks too long.